This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, November 25th, and I'm Zach Caruso. Our lead story this week is in JAMA Health Forum and is titled Fatal Opioid Overdoses by Historical and Contemporary Neighborhood-Level Structural Racism. This cross-sectional study of 796 census tracts prior to the COVID-19 pandemic and 792 census tracts during the COVID-19 pandemic in Chicago, Illinois, assessed the extent to which there's a spatial association between neighborhood-level structural racism and opioid-involved overdose deaths. Researchers found that neighborhoods exposed to high levels of structural racism in the past and present had the highest fatal overdose incidence rates before the COVID-19 pandemic. Neighborhoods that experienced high levels of contemporary racism had the highest fatal overdose incidence rates during the pandemic. Next is an article in the Harm Reduction Journal titled Harnessing Telemedicine to Deliver Patient-Centered Opioid Agonist Treatment Within a Community-Based Harm Reduction Service, a Mixed Methods Evaluation. This paper utilizes longitudinal chart review and semi-structured qualitative interviews to describe the development and outcomes of a telemedicine OUD treatment clinic co-located within a community-based harm reduction program in Montreal, Canada. Telemedicine visits with a medical team based out of a hospital addiction medicine service were facilitated by community harm reduction workers. Patients were offered methadone, buprenorphine and naloxone, or slow-release oral morphine for treatment of OUD, with or without hydromorphone co-prescription. Between April 2020 and March 2022, 69 patients started OUD treatment, with the majority reporting injection drug use and unstable housing. 54% of patients chose methadone, 35% chose slow-release oral morphine, and 12% chose buprenorphine, with 78% receiving co-prescribed hydromorphone. Retention in care was 83% at 1 month, 74% at 3 months, and 54% at 12 months. Patients reported that trust, respect, patient-centered care, and the integration of harm reduction principles were critical to the program's success. Our next article is in the Journal of Addiction Medicine and is titled Dutasteride as a Treatment to Support Reduced Drinking, a Randomized Placebo-Controlled Trial. Dutasteride inhibits the enzymes 5-alpha reductase involved in the production of neuroactive steroids that modify GABA receptors. These neuroactive steroids are increased by ethanol, and this study explores whether inhibiting the production of these steroids will reduce alcohol use. Participants meeting criteria for alcohol use disorder were randomly assigned to receive either dutasteride 1 mg daily or placebo for 12 weeks. Dutasteride compared to placebo reduced both standard drinks per week and heavy drinking days. Reductions in phosphatidylethanol confirmed the self-reported reductions in drinking. Adverse events did not differ significantly in the two groups. The drinking reductions were less in women due to a greater placebo response in women than men. The authors conclude that dutasteride reduced heavy drinking. Next is an article in the Harm Reduction Journal and is titled Implementation and Formative Evaluation of a Peer-Led Chemsex Intervention Targeting Sexualized Crystal Methamphetamine and GHB Use, the METHOD Study. This paper describes the implementation and evaluation of a peer-led chemsex intervention called METHOD based in New South Wales, Australia, which seeks to address barriers to care and improve harm reduction engagement for gay, bisexual, and other men who have sex with men, or GBMSM, who use crystal methamphetamine and GABA hydroxybutyrate, or GHB, in sexual contexts. The study assessed acceptability, feasibility, and appropriateness of the service through 33 semi-structured qualitative interviews with clients, community members, METHOD peer workers, METHOD managers, and clinicians. Researchers found the METHOD program was acceptable and appropriate, with appreciation from clients for peers' personal experiences, which allowed for the rapid development of rapport and trust. The intervention was feasible as long as robust support for training, technical support, care for peers, and strong referral pathways were in place. Our next article is in PLOS Medicine and is titled Association Between Cigarette Smoking Status, Intensity, and Cessation Duration with Long-Term Incidence and 9 Cardiovascular and Mortality Outcomes, the Cross-Cohort Collaboration. Tobacco use remains a leading cause of cardiovascular or CV disease and mortality, and to better understand this relationship, researchers assessed risk by pack years, cigarettes per day or CPD, and years since cessation. Researchers found that even low-intensity use was associated with increased risk of various CV outcomes, with risk increasing with increase of intensity of use. Cessation provided substantial immediate decrease in risks, which decreased further over time. Notably, former smokers with greater than 20 pack years of use had lower risk than current smokers with less than 5 pack years of use. Researchers note that while duration and CPD are important in determining risk for current smokers, in former smokers, time since quitting may be more important than total pack years. These findings highlight that helping patients quit smoking, not just cut down, should always be the goal. Next is an article in Addiction and is titled Contingency Management Interventions for Substance Use and Addictive Behaviors, Review of the United Kingdom Evidence Base. Contingency management, or CM, can be effective in changing behaviors, including abstinence and adherence to other evidence-based treatments, including medication for substance use and non-substance use-related disorders. Researchers conducted a scoping review to evaluate implementation of CM in the United Kingdom. Overall, researchers found CM to be clinically effective, including digital approaches, but they also identified several barriers, including resource limitations such as staff shortages, direct costs, and training requirements. Other barriers included possible ethical concerns about CM potentially being manipulative, risk of relapse when CM stops, and negative impact on therapeutic relationships. Given the demonstrated effectiveness of CM, the authors underscore the need to address these barriers. Our next article is in JAMA Health Forum and is titled Internet Searches for Lorazepam Following the Release of the White Lotus. On February 16, 2025, HBO Max released the third season of The White Lotus, which featured a central storyline in which a character repeatedly used lorazepam for anxiety, with frequent on-screen references to this benzodiazepine. Given that shows on streaming platforms can contribute to public interest and health behaviors, and lorazepam carries misuse risk, the study evaluated whether The White Lotus Season 3 release was associated with increased public interest in lorazepam and compared trends with other commonly prescribed benzodiazepines. Researchers found that weekly internet search rates for lorazepam remained stable from January 2022 through the first week of February 2025, then increased following the release of the third season of The White Lotus and remained elevated for 12 additional weeks. During this 12-week period, lorazepam queries were cumulatively 98% higher than expected, representing approximately 1.6 million additional searches. During the same time frame, queries for alprazolam and clonazepam remained at expected levels, at 1% and 0.0% of expected volumes, respectively. Our final article is in the Substance Use and Addiction Journal and is titled Online Narcotics Anonymous, an option for addressing methamphetamine use disorder. This commentary describes the position on drug policy of the Association for Multidisciplinary Education and Research in Substance Use and Addiction, or AMERSA. The authors note that in the past, the war on drugs was punitive, not evidence-based, and produced societal damage. Currently, xylazine scheduling and drug-induced homicide laws also criminalize people who use drugs and make them reluctant to access harm reduction services and help with overdoses for fear of arrest. The authors state that drug use is a public health concern and should be approached with evidence-based and compassionate approaches. Evidence-based approaches include drug checking programs, overdose prevention centers, and Good Samaritan laws. AMERSA recommends that healthcare experts and people with lived experience be included in drug policymaking and opposes policies that impose criminal penalties. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.